gonna be doing an NG tube today. So I have doctor's orders, and what I need for this is the NG tube here. I need some paper towels. I have 2 sets of gloves to be able to take one off and not get a ton of lube on her face when I do it. I need the lube, and I need a cup and water and a straw, but we don't have that here, so in theory we'll have that. So first of all, I'm gonna make sure I have the doctor's orders, and then I'm gonna come in, I'm gonna introduce myself, make sure this is a patient that I need, ask her to identify herself with 2 identifiers, and it's the person I'm looking for. So I'm gonna sit her head up to 90 degrees to place this tube. We're almost there. Okay, and while I'm sitting her up, I'm gonna ask her if there's any reason she can't have an NG tube, like she had some facial trauma, has something broken, has had a rhinoplasty, and she hasn't, so I'm gonna go ahead and continue. I'm gonna do hand hygiene, and then throw some gloves on. Okay. I'm gonna check her nose to see which one looks like the better side to do, and it looks like this left side's gonna be better. So I'm gonna take this pillow out from behind her head so that it's easier for her to tip her head for us. And then I'm gonna have this here in case she needs it. And I'm gonna add some lube to this, and I don't need a ton. Make sure it's got enough on there. I'm gonna measure first. So I'm gonna start with the nose, go around the ear, come down to about right here. So that's gonna be 60. Okay. And then I will have my tape ready at the same time too. So her head is gonna be up. I'm gonna get it to the back of her throat. And it looks like we're there. I'm gonna have my assistant give her a sip of water, and every time she takes a sip, I'm gonna push it in further. And take a sip, take a sip, take a sip, take a sip, and one more. Okay. And then I will have my tape ready at this point. The tape here, and wrap the legs around here like this. Okay. And then I have my hair tie or rubber band and my safety pin. I am going to pin this to her clothes so that it doesn't get hooked on anything, get ripped out, she needs to go to the bathroom, anything like that. Okay, and then I'm gonna add the pillow back for comfort. Okay, and then I consider down to as low as 30 degrees. I don't want to go any lower than that because I got to keep the NG tube above her stomach, still in her stomach. So I'm gonna clean up my mess, get all of my stuff out of here. And then for charting, I'm gonna chart the time, the date, how long the NG tube is, like what gauge. I'm gonna chart how much I went in, how the patient tolerated it. And then I'm gonna make sure to chart that we're gonna get an x-ray to make sure it's in the right place. Okay, so it's been like 3 days. I have an order to take it out. I'm gonna confirm her identity with 2 identifiers, and I'm gonna do hand hygiene, put some gloves on, let her know what we're gonna do. And for this one, I need a paper towel. So I'm gonna put this here for now while I get this ready. And I'm gonna take the tape off. If I need to, I can use alcohol swabs. Okay, and at this point, I'm gonna hold this up here, and we're gonna do it in one swift motion. 1, 2, 3. Perfect, and I'm gonna help her clean her face off too, because I'm sure that wasn't pleasant. And at that point, I'm gonna chart how much I took out, like how long it was when I took it out. I'm gonna chart how she tolerated it, at what time I did it, and my name.